Cocaine, however, can be extremely notorious to be very addictive from the first hit ever. Very hard to quit. You either become too excited and become the blabbermouth of the party, and you can also find it very hard to control yourself. A lot of people have sweating, they have physiological changes, they may have tremors, they may just start even ignoring food because cocaine really cuts down on your appetite in that moment. Now, as a doctor, what do we look for? We look for the pupillary dilatation, which means your pupils become really big when you're on cocaine, and that's how we can tell that you're having cocaine. In fact, your pulse rate goes through a roof, your blood pressure can fluctuate, your hands can start sweating and having tremors, which is the basic intoxication for most of the drugs out there. The cocaine withdrawal is not pretty either. So because cocaine is an upper, unlike the opioid which was a downer, after the high of cocaine, people have a crash, which means that suddenly you find them lethargic, fatigued, not wanting to do anything, yawning, and not wanting to get out of the bed for days at an end. However, in general, your blood vessels can start to get affected. Your blood pressure can go out of whack. You can develop a lot of systemic problems over the period of time. What are stimulants? Drugs that make you go absolutely alert and hyper. MDMA, the ecstasies, the mollies, the meow meows, which is mephedrone, which is relatively recent and new drug, synthetically made. These drugs are all notorious for highly addictive potential. When you're high on drugs, after the nice trip, there could be some really negative factors. For example, feeling a lot of anxiety and feeling fearful. You can have palpitations. You can have tachycardia, which is basically being aware of your heart rate. Now comes the very notorious part, which are the hallucinations. There could be something called depersonalization and derealization, which means you're sitting here, but you can also watch yourself from a distance at your own self and imagine yourself being a third person. And this happens in full consciousness, not in the state of dream. These are the notorious parts of amphetamines. Just like cocaine, when you get off MDMA or any other stimulant all of a sudden and have a crash, you may start feeling extremely anxious, fatigued, tired. Your body movements may become extremely slow and uncoordinated. Your heart may start pounding, or you may start having a slowing down of your heart rate. Psychosis, memory issues, depression, and one of the main things that we find a lot of individuals go through is extreme sadness, leading to suicidal ideas, especially in drugs like MDMA. LSD, magic shrooms are extremely common and party drugs used to bring in about a high. Individuals have reported very bizarre hallucinations on LSD, and that is the purpose of the hallucinogen, to induce different forms of magical hallucinations. So some of the people have reported that they start to see music and they start to hear things in different modalities. For example, a visual art starts to sing to them, whereas the music becomes an actual visual. That's how magical it can be. But beyond this magic trip, there can also be a crash. In the aftermath of the LSD, the shroom party, you may feel extremely lethargic, not wanting to get out of bed. Your generalized sense of being becomes extremely depressed. Your cognitive status becomes extremely that of someone who doesn't feel like there is a lot left in life. Physiologically, your sleep, your appetite, your body starts to suffer.
Welcome, party over, go home!